Erica Acido, and I am here to demonstrate the proper procedures of taking vital signs. So vital signs are physiologic measurements of the neurologic, metabolic, respiratory, hormonal, and cardiovascular status of the body. They include the body temperature, pulse rate, respiratory rate, blood pressure, and oxygen saturation. So these measurements are utmost important because they are the basis for identifying physiologic disturbances or even life-threatening health conditions. Thus, vital signs are monitored periodically. So, vital signs include blood temperature, in which blood temperature is the balance between heat produced and heat lost from the body. Body heat is primarily produced by metabolism. The heat-regulating center is found in the hypothalamus. Next is pulse rate, and it is the wave of blood created by contraction of the left ventricles of the heart, and it is regulated by autonomic nervous system, or also known as ANS. Now next is the respiratory rate, in which it is the act of breathing, transport of oxygen from the atmosphere to the body cells, and transport of carbon dioxide from the cell to the atmosphere. Next is blood pressure, and blood pressure refers to the force of blood against the arterial walls. The maximum blood pressure exerted on the walls of arteries when the left ventricle of the heart pushes blood through the aortic valve into the aorta during systole. So the main objectives of taking vital signs are to monitor the client's physiologic health status, to provide the baseline data for future comparisons, then to identify health alterations. Next is to identify contraindications prior to administration of medications. And lastly is to identify contraindications prior to any diagnostic or invasive procedures. Now, as for the materials needed, we will be having thermometer, BP apparatus, cleansing alcohol balls in a container, taking forceps soap in an antiseptic solution. If using cotton balls, it must be soaked in alcohol. Next is clean gloves, and then waste receptacles or kidney basin, then face towel of patient, then wristwatch with second hand. Now we will be proceeding to demonstrating the proper procedures of taking vital signs. So now I will be demonstrating the proper procedures of taking vital signs. And in taking vital signs, we must first prepare all the materials and equipment needed for the procedure. So I have here my alcohol and my 2 cotton balls, in which these ones are wet or already applied with alcohol, while these ones are dry. Then I also have my paper towel, my thermometer, and then my stethoscope, and my sphygmomanometer. So now, in starting the procedure, we must first greet the client, introduce ourselves, and verify the client's identity. We can also briefly explain the procedure so that we may be able to establish cooperation with the patient during the procedure. Good day, sir. I am Erica Acido, and I will be your student nurse for today. So I will be taking your vital signs as per instruction by your doctor. So before that, sir, may I know what is your name? Right. How about your age, sir?
20.
Alright, thank you, sir. Now that we have already verified the client's identity, we will then proceed to taking the first part of the vital sign, which is body temperature. So in taking the body temperature, we must ensure that the client is calm and quiet and ask what the client did for the past 12 minutes. And if the patient was engaged in a strenuous activity, we must allow 10 to 15 minutes to rest. So today, sir, I will be taking your vital signs, and vital signs includes your body temperature, your pulse rate, your respiratory rate, and then your blood pressure. So before that, sir, may I know what are the activities that you have done earlier and were you involved or engaged in strenuous activities?
Just sleeping.
Alright, sir, that's good to know. So now we are going to proceed to taking your body temperature. Now, in taking the body temperature of the patient, we must expose the patient's axilla by securely folding the client's shirt sleeve or gown up to the deltoid region. Going to fold this, sir. Now, we have to determine if the patient's axilla is wet. And if the patient's axilla is wet or moist, then we have to dry it with paper towel in a patting motion. So we are going to get our paper towel and then create 4 folds. So we must make sure that there is 1, 2, 3, and 4 folds, and we must make sure that each side should touch only once to the patient's axilla. Now we are going to dry the patient's axilla in a patting motion. And then after drying, we have to discard the paper towel. Now after that we have already dried the patient's axilla, we will then going to get our thermometer. We have to remove it from the container and then disinfect the thermometer. In disinfecting the thermometer, we are going to get a cotton ball that were applied with alcohol and then wipe it from the sensor in a rotating motion down to the neck of the thermometer. Then discard the cotton. And then place the thermometer at the center of the axilla of the patient. Now after the thermometer is placed, we are then going to assist the patient to place his arm across his abdomen so that it can hold tightly the thermometer. Sir, may you please hold your arm across your abdomen so that it will hold the thermometer. So we must note that when a patient is irrational or is very young, we have to remain holding the thermometer to prevent it from falling. So now, since the thermometer usually takes about 3 minutes before it buzzes, we're then going to take the peripheral pulse of the patient to the other side. So now, since the patient is already in a comfortable position, we're then going to select for the pulse side point. So normally, what we are going to take is the radial pulse. So now, in taking the radial pulse, we must place 2 or 3 fingertips, the index, middle finger, and ring finger, lightly and squarely over the pulse point. We must never use our thumb, for it has our largest artery, which is called the princeps pollicis. Now we are going to place this into the radial pulse of the patient, and then we must note that we have to let the arms rest in 90 degrees angle across the abdomen with palm facing downwards. So now we must observe the first minute regulatory of the pulse. We must count for 1 full minute. that we have already observed the client's radial pulse, we're then going to note the pulse rhythm and volume. So, continuing, we are going to proceed to the assessing of the respiratory rate of the patient by looking directly to the patient's chest or diaphragm. We are going to determine the rise and fall of the respiratory of the patient. So we must count the respiratory rate in 60 seconds, and one inhalation and one exhalation are counted as one cycle. So we must just remain our 3 fingers in the radial pulse of the patient so that we can prevent any conscious exertion of breathing. Now we have to count for 1 full minute and observe for the respiratory rate of the patient. Now after that, when there are any abnormal breathing pattern that are noted, we must use the next 60 seconds to carefully observe the characteristics of the client's respirations. And if there are any abnormal findings, we must refer it to the physician if there are any complaints from the client such as difficulty of breathing. So now we are going to proceed to taking the blood pressure of the patient. Before that, we are going to remove the thermometer and disinfect it. But this time, in disinfecting the thermometer, we are going to start from the neck or the base up to the sensor. And then place it again to the container so that the thermometer is ready for the next patient who will use it. So now, in taking the blood pressure of the patient, since we have already asked him if he has done any strenuous activity earlier and he answered that he was just resting, we can now then proceed to taking his blood pressure since we no longer have to let him rest for about 10 to 15 minutes. So now in taking the blood pressure, we must fold the patient's shirt sleeves or gown up to the shoulder, making sure that it is secured and will not fall to the brachial area. Now after that we have folded the shirt sleeves of the patient, we are then going to identify for the brachial pulse. For this is where we are going to place our sphygmomanometer. So in identifying the brachial pulse of the patient, we must place 2 fingers and palpate for it. Now after identifying the brachial pulse of the patient, we are then going to smoothly and evenly apply the cuff with its lower border located at about 2.5 centimeters above the antecubital space. So the measurement of 2.5 centimeters, we can just use our index finger and the half of our third layer of the index finger. So now we are going to measure if the cup is snugly fitted by inserting 2 fingers into the BP cup. Now after that is we have to make sure that the tube is placed in line with the brachial artery. Now after this is we are going to position the manometer vertically at the eye level. Observation should not be farther than 1 meter or approximately 1 yard away. You have to place it perpendicular to our view. So now we are going to insert the earpieces of the stethoscope in the ears so that they tilt slightly forward. We must make sure that the sounds are clear and not muffled. We must also ensure that the stethoscope hangs freely and is not at any contact with any object. So we must warm the diaphragm of the stethoscope by using our palm. Then we have to locate the brachial artery and place the diaphragm of the stethoscope over the brachial pulse. We must secure the chest piece by placing over the palm of the non-dominant hand over it. So now, by using our fingers, we are going to use this to prevent the stethoscope from falling. After that is we're going to close the valve of the pressure bulb clockwise until it is tight. Now after that is we are going to quickly inflate the cup until the last sound, then add 30 mm per mercury. And then after that is we are going to slowly release and open the pressure valve and allow the manometer gauge to fall at a rate of 2 to 3 mm of mercury per second. Now after that is we are going to note the point on manometer where the first clear sound is heard. The sound will slowly increase in intensity. And then we are going to continue to deflate the cuff and noting the point at which sound disappears. So we must listen for 10 to 20 mm of mercury after the last sound, then allow remaining air to escape quickly. After that, we are going to remove the cuff from the client's arm and assist patient to assume a comfortable position. Cover the upper arm if it was previously clothed. Now we are going to position the client comfortably. Now after that is we are going to wash or disinfect our hands. Now after disinfecting, we are going to discuss the findings to the client and do health teachings as needed. So now, sir, upon taking your vital signs, we have noted that your body temperature is 36.8 degrees Celsius, your pulse rate is 84 beats per minute, and then your respiratory rate is 18 breaths per minute, and as for your blood pressure, it is 120/80. So the overall findings of your vital signs, sir, are all normal. So there are no need to worry about, and you must have to continue your healthy practices. That would be all for today, sir. Thank you.